Let's talk about cyanosis. Cyanosis is when parts of the body turn blue due to lack of oxygen in the blood. This happens when hemoglobin has no more oxygen to bind, and so your tissues start to be depleted. It's most notable first in areas with a very thin skin, such as the tips of the fingers, the eyelids, and the lips. Now, cyanosis isn't actually a disease or necessarily a problem itself. It is a symptom of other problems, namely there not being enough oxygen. There can be many different causes of cyanosis, such as asphyxiation, congenital heart or lung conditions, which makes it difficult to get oxygen to the correct places. It can also be caused by issues with the blood itself not being able to pick up oxygen, or respiratory issues like asthma or pneumonia. Basically, there's a very wide variety of things that can cause this specific symptom. It's also important to note that cyanosis does look different on different skin tones, and due to the medical system, people with darker skin tones sometimes have signs that are missed, such as cyanosis. Most textbooks and examples such as this one show cyanosis and a bunch of other things as well on light skin tones, and that does cause the signs and symptoms of quite a different things, again, not just cyanosis, to be missed on people with darker skin tones, which is a whole problem. Now, cyanosis can also be sometimes associated with necrosis, or the kind of dying off of skin and other tissues. Cyanosis and necrosis do not cause each other. Usually they are both caused by an underlying root condition. Now, cyanosis is much less severe than necrosis, and they're also different things as well, but they can both show up due to the same conditions. Cyanosis, depending on the root cause of it, can be reversed quite easily. If it's due to something like the cold, where poor circulation causes the ends of your fingers to kind of go numb in the cold, and then you may develop cyanosis, that can be reversed by just warming up the fingers. Or for things like asthma, it will be reversed by returning oxygen to the system by perhaps taking an inhaler. However, for more serious things like congenital issues or pneumonia, it usually will go away with the treatment of those issues. It just takes a little bit longer and might be a little bit more severe.